6:30, call the Health Human Services Resource Meeting in order. Roll call.
Dale Schluter,
Here.
Tweed Schuman,
Here.
Dale,
Here.
Chuck Van Etten, Don Pettit, Lorraine Gouget, here, Jennifer McCormick, Carol Pearson,
Yes.
Dr. Sabrina Dunlap.
Okay, we have a quorum and certification of compliance with open meeting laws.
The meeting has been noticed to the public and news media as required by section 1824 of the Wisconsin statutes.
Okay, the agenda, okay, as is, any changes? Moving on, public comments. Do we have any public here? Okay. Committee reports.
Motion to approve the agenda.
Did I miss one?
Approval of minutes number 6.
Yeah, that's, okay. We need to approve the minutes from the last meeting. Carol?
So moved,
Okay,
yes.
so Tweed seconds.
Yep, I'll second that. I was just
Everybody in
pulling it
favor
up.
say aye.
Aye.
Motion passed. Now committee reports. Maureen, I guess you.
Yeah, I was going to give a update from our clinic and a couple other things I wanted to mention. The LCL Health Center has fully vaccinated 3,100 patients since March 2021. We have partially vaccinated 96 additional patients. We will be providing another J&J vaccination event at the LP plant at Hayward later this week. This is a single dose vaccine. In 2 weeks, we will be following up with the second dose Pfizer vaccines at the LCO Casino Conference Center. We will also be providing the J&J Janssen vaccine for those who want this one-time vaccination at that time. As of today, LCO has only 2 positive cases of COVID-19. Our COVID response team has done an awesome job of COVID-19 testing, tracing, and vaccinations. We will be providing a mass vaccination clinic at the upcoming Honor Year Call in July. That is our annual homecoming call. We're not having it full open, but we are going to have one as safe as we can. This will be a Johnson & Johnson vaccine, which is a 1-dose vaccine. As many traveling from outside may not be able to attend a second vaccination 3 or 4 weeks after the first vaccine. So we're trying to plan for those who have not been vaccinated yet and try to do it at 1 dose. As always, anyone wanting a COVID-19 vaccination, please call the Community Health Center 758-5100 to schedule an appointment for Pfizer, Moderna, or Janssen vaccine. That was an update on the vaccine. Then I wanted to update on some of the things that we're working on for the tribe. Our daycare center is still working on that licensure piece. Once that's in place and once we get our staff, they're working on certification and their piece there so that they're ready. And so we're looking at probably around the 21st of June, and we'll open up our doors. So once we get that open, that'll be helping some of our families so they can go to work, go to school, and do those things they need and have that care for those children. So, and families. Our women's shelter is also being staffed now because we separated the domestic piece from the women's. It just was not working. So we separated that. So the women's shelter, we have a director and an assistant, and then now we're getting staff in place to help our women and children. And we're also trying to plan on, with both of the men and women's shelter, tying in more of the services in our community so we can help address those needs that they have to why they're homeless for one thing, and when they have other health effects that they need that extra help and support with. So we're trying to utilize what we have in the county and within the tribe to help them in ways that we can, and then help them get going again for the independent and self-sufficient. We do continue to battle with the addictions that we're seeing in the community. We're trying to send our people to treatment as quickly as we can. That need is there, so we're trying to get the help that they need, and then we're still working on that transitional piece for the aftercare because that is really needed in our community when they're coming home. They can't just go right back out in the community and be with their friends and do the same thing because they fall right back into their addictions. So we're trying to find ways to address that We're looking at, one of the facilities that we've been refurbishing, to have it to be a, transition house. And we're looking at servicing maybe 8 to 10 men there. And then, there's 2 other facilities or buildings that we are finishing up now, and they will be community-based to help within the villages that are farthest out, so they have a healthy, safe environment just to be together as a community, and to continue with those efforts to have good things happening and to come together in villages. So once those are done, we're putting it back out there for the community, and some of those villages will have that, whatever they would like to do at that time. We're also looking at, we're sending our people, like I said, to the treatments, but we're trying to utilize whatever support we can. I'm telling you, these addictions have taken a lot of our people, and we continue to do so. And so we're trying to intervene and do what we can as much as we can, whether we do education or through programming, our services, whatever we can do. With the tribe is also working on how we can use the ARP monies now that have been distributed out to the people, and we want to address the health issues and economic hardships that we faced, and how we can help our tribal members that were affected during this pandemic. So we are trying to take care of them in different ways. We're going to be sending out a stimulus to them, to our membership, and we're also trying to build more housing, because that's another issue, our homelessness, and apartment building maybe. And we're planning different ways on how we can help address that, because our people, we have a number of homeless people, and some of our people don't qualify for low-income housing units, so they need support too. But we're trying to plan on those. And some of the bigger things that we're looking at is our community health center. What we have, like I mentioned before, we're continuing to plan for that now. And a fitness center, we changed it from wellness to a fitness center to keep our people active and healthy, so we can kind of change the wording a little bit. Elder center we need for our elderly. A police station, just certain key things that we need for our people, so we're trying to plan now for those things. One of the things that we have to work on too is the water in Signer. In that village, that's been a concern for many years, and we're trying to do the infrastructure and the piece that need to address that water issue that we have down there, and how we can help that to be healthy, and so the people in the village there can have what they need. And they've been putting up with that for a long time, so we're going to address that. And tomorrow night we have a healing gathering for the community. We've lost a lot of our people, and we want to have our people come together and support each other and be together in a good way, no matter what faith or belief or whoever, those who are grieving, to welcome our community to come together in that good way. And that'll be from 5 to 7 tomorrow night by the tribal office, right, Chris?
Yep.
By the tribal office.
Pavilion there.
Yeah, and they'll have a memorial walk and a little picnic and speakers, and people will be praying, candlelight vigilance, the different things that we'll be doing for our community. So that's important, because a lot of times when our people are grieving, that's where some of the addictions start. They don't heal in a good way, and then they turn to those unhealthy ways to cope, and then so. And some of the most recent deaths, I just wanted to add that to the piece on the COVID. Some of our members that we lost recently had COVID-19, and then they had other comorbid conditions. However, when they got the COVID, that kind of was the piece there that kind of, they weren't able to fight off what they were battling. So some of our members we just lost recently that attributed to their cause of death. So, but and there was a few of them. So, but this pandemic continues. It's not gone yet. So the tribe is trying to be as careful as we can while we move forward. And I think all the tribes in the state are trying to be as safe as we can and do things little by little so that we don't go too fast and get sent back to where we were. Want to have some kind of normalcy again. But I think that pretty much covers everything.
Just that we continued our masking mandate in our
Yeah.
enterprises.
Yeah,
And we're getting some pushback from that. I was explaining that to Julia. We're gonna put a picture of Julie up there with a mask, I think. And we have that big country western singer coming with a big concert at the end of June, and people are telling us that we're not coming if there's a masking mandate. So we need to address that. But in the government building, we went to a highly recommended that you wear a mask, and if you're vaccinated, you didn't have to, so.
but anybody coming in has to wear masks, because we don't know who's vaccinated or not.
Right.
So we're still trying to do those safety measures.
You have a lot on your plate.
Yeah.
Any questions?
Yeah.
Senior Resource Center.
No report.
Admin. Oh,
There's nothing on
adult long-term care.
there. Lori Perlich submitted a report. I'll just highlight a couple of things. One is she highlighted World Elder Abuse Awareness Day, and we added today Lori's request. Lynn added a proclamation by the governor, so it's on the website. Anybody wants to take a look at this, you're welcome to. And then the other one, she mentioned in here that Metastar is going to look at the ADRCs and see and estimate the economic impact of the ADRCs in the state. I will make a side comment about Metastar. I hope they do a better job on what they're doing at Birth to 3 right now, because it's an uproar within the state and all the counties, because their assessments of Birth to 3 programs from the state are really poor. And I believe they put them on hold now for a little while until there's a meeting with, Wisconsin County Human Services Association really pushed to have this happen with the support of all the directors, so they do a better job. Just a quick tell you what's going on in some of these Birth to 3 programs where they scored high in the past. Now they're coming down, they're getting zeros. And people don't understand. It sounds like the assessment is poor, and some of the staff they have are an issue. So it's going to get addressed, and I hope whatever Metastar has for the ADRC is going to be up to snuff. But just a little side comment I threw in tonight.
So, excuse me,
Go ahead, Carol.
is the Birth to 3 thing being renegotiated or done over?
No, they have site visits. Oftentimes the state comes, but there's something going really bad this year about how they're doing the site visits. And the results are very poor for a lot of counties. And the counties are going, what has changed? Everything's been okay before.
Right, right. I
And so
understand that.
then you have two problems. One, staff morale's going down because they think they're doing okay. And then you have the consumers that are taking part of this going, well, this program's not any good then. So you get all this pushback. But I think through WICSA and all the support of the directors, they've got attention of Metastar and the state, and we're hoping it's going to lead to a meeting to get this resolved. And so I see Metastar now, that's what I think of.
And we're not scheduled till December.
Right.
We got a lot.
And it got so bad that some of the counties were saying, we're not going to participate with the site visits. So that really got their attention, and now Metastar's just halted it, so we'll see what happens.
How many kids do we have in our Birth to 3 program?
At the moment, we're just under 20, kind of 17 to 20.
Really?
We've been upwards to 30, so we kind of wax and wane as kids come in and out of the programs. So right now, Birth to 3 is doing a big push and an effort to help make sure that we get the referrals that we should be getting into the program.
Well, they used to say, what, 2% of the population should be in Birth to 3?
I remember that stat.
Oh.
And that was from a long time ago.
Oh, does that include the tribe too?
What's
That's
that?
2%.
Does that include the tribe?
For
too?
the,
The numbers that you're referring to?
no, it's in our birth certificate. We
Oh,
see
okay.
a lot of tribal families in ours. so I'm not sure.
Yeah, because the tribe has pretty, so interesting to know.
And is Deanna still,
Yeah,
we're reaching out to her.
Birth
Yes.
equity is a program very near and dear to my heart.
Yeah.
So,
It's an excellent.
Yeah, right?
Okay.
Untitled behavioral health.
Yeah. Is that you again, Paul?
Under behavioral health, there's a few reports. One is from Alicia Carlson. I want to highlight a couple things in there. And that is through the CST program. She was able to get a grant to start establishing electronic health records down in that unit. And one of the things that's going to be helpful is to be able to coordinate. Those records can be used with CST, CLTS, CCS, all the C programs down there. Some people are happy about the change and some people still like the paper records, but we'll work around it. We're in CCS. Alicia's been working her tail off and with Taylor County trying to find mental health providers. It is really difficult. We have one with North Lakes. The problem is, and she's been really good, but she's booked out for months. I think Carol, I heard Cheryl got a hold of you about perhaps getting Aaron going. And then we thought that SOAR Counseling that has a clinic here in town was going to be on board, but I guess they're only willing to have their therapists in Park Falls be certified for CCS, so that doesn't help us. And then there's really nothing else left.
Paul is, Aaron is, he's certified now.
Yeah, that's right. Alicia did tell me that's great, but the problem, no one's looking for a male therapist right now, so we just can't seem to win on that. And they are getting a number of referrals through CCS. Just the therapist part is a hard part, hard to recruit. So, also,
Paul, before you leave that, I see Alicia comments that a full-time in-house clinician might be economical for us, meaning it's not working to partner with these other clinics. Would they see enough people to sustain their position?
well, Tom doesn't know this, but that position's still there, and I didn't think we were going to refill it because I thought we could get it within the community. So I'm getting ready to. First of all, if we can even find somebody, and I was talking to Rose about this was going to come. I was going to talk to you about this, but we were going to post for even a part-time person, a full-time person. Based upon past experience, I think it's going to be difficult to find somebody, but Rose is, I'm going to pass Teflon slide to Rose. Rose has been encouraging us to think about doing it to see if we get any hits at all. Again, I've said so many times, it's the synchronization, is having everything in place at the same time. Alicia's indicating that they're getting a number of referrals for CCS, but we have to put it on hold because we don't have this other stuff in place. Now we got CCS staff, facilitators ready to go, and so I guess on that, stay tuned.
Well, it does sound like something that's worth looking into.
Right, but then you go, if we get the person hired, then it's all timing to make sure there's enough referrals to fill the person's schedule up.
Exactly.
So well, you've heard the stories.
So do you ever work with the tribe? Is that not ever been done, or you done it, or?
Well, then they wouldn't.
If you need therapists and if we have some, you ever? Yeah.
Well, they'd have to be travel members or have a relationship where it's okay for them to see the therapist on the reservation. I guess that would be.
Well, I thought it was open. Isn't it open, Sweet?
Our mental health?
Our services, aren't they open to the community?
I don't think yet.
Not yet?
No, when I worked in the clinic there part-time, they had to be travel members or somebody married
Or
related
spouse,
or spouse, yeah, and that was,
In
Or
behavioral
an
health?
employee
mental
that's-
health?
yeah, right. I just assumed that
I know
hasn't
the
changed.
clinic does. Clinic sees I'll remember.
starting to open up, but yeah. it's
It
not.
is, it's open, I've seen them. So, but I was just curious, I just wanted to ask. Because that would just give you more support for your CCS.
Therapy part of it, yeah.
Yeah.
I
I
know.
was just curious.
Well, you said the surrounding counties are having problems filling this position too.
Oh, it's hard to find, oh my God, hard to find therapists.
Any-
It's mental health therapists.
Yeah.
And like I've said previous time, even more difficult to find people like Joe and Alicia that have dual credentialed.
Yeah.
They're substance abuse counselors and mental health therapists. They're like almost impossible to find.
I think Aaron is.
Aaron,
Aaron is now,
Aaron.
that Northland,
Yeah.
Northland.
so
Is it possible to partner with other counties and do a broader search? Or
that's what Taylor County has to work on. They're the ones that find, they're the ones that work on contracts. Right, so like even with Northland, with Carroll, we have nothing to do with that. That's between Taylor County and Northland, getting that set up. Although Alicia is known to be nudging to get that to happen, so. And then the other report on here is the mental health cost by client report. As promised, Cindy Hannes has revised it, and we just have it to date for this year. And although the total's not on here, a rough calculation would indicate that the cost so far, if you look at the right-hand column, was over $500,000 to date. Placement costs for mental health. And she even has an average down there, 131, 328 per month.
Well, maybe I don't.
Oh, also, yes, and Joe also has a report in here as well about the placements. Update.
If I could say something about the placements. We currently have one person in Winnebago, and we've relocated the others, and that's a good thing.
Yeah.
The one person that we have that is the high cost that he wants to look for a place to live somewhere else, but he's still ours. And, he's looking, that individual, that they were talking about 2,000 a day or whatever. He's currently being housed in Carroll's facility in Ashland, and knock on wood, he's doing, well. So she's actually able to manage him, outside of the fact it's disrupting her program because he takes a lot of attention, but she's managed, right? You're managing him fairly well. And hoping that we can launch him out to where he would like to go sometime soon. So, but I do anticipate that Winnebago cost could actually be less than we projected.
I hope so.
You know, I would like to say deviate just a minute if it's possible. Currently, we have a gentleman in Winnebago who is there on an emergency detention who suffers from Alzheimer's. If the county and the Wisconsin Counties Association ever wants to do anything, they should get a proclamation or go to the state so that people with Alzheimer's don't end up there. They end up there because there's no beds for people in crisis that have Alzheimer's. And to take a 70 or an 80-year-old gentleman who doesn't or gentlewoman who doesn't understand what's going on and put him in the same floor with chronically mentally ill people that are 18 to 20 and can strike out, it's just not right. It's a criminal. And the reality is those folks don't have a group. There's an Alzheimer's Association, but they don't have an advocate group like a lot of these other groups and different types of people do. It is really not right. And we end there because there's nowhere else to go. And that needs to change somewhere in the future. And I would also say, Lorraine, I'm seeing the same thing with an increase, more people calling for services and AODA. And I still believe there should be a committee, and the tribe and the county should get together and look at a cooperative residential treatment program. It's billable under Medicaid. If you're going to have a residential program, you should have a treatment component with people maybe trained from the college to do some things there as well. And that is a billable service. That could be something to move towards in the future. That's what I have to say.
Good idea, yeah.
Mr. Chairman, I got a question for Joe.
Yes.
Joe, are these related to that chapter 51 placements you do as well? Or is that something different?
Well,
Because that's come up in our state tribal relations board and we're addressing that.
they should be,
No.
everybody in the state is having problems. People with infirmities of aging, that is, they're not likely to get better, that's Lori's group. Those are people under chapter 55. They can be taken into custody and get an, emergency guardian and placed in a facility. But there's no facilities for these people. So when you have somebody with Alzheimer's who's being violent and unmanageable and presents at the hospital, the only thing to do is to put them on a 51, which they shouldn't be on by the Supreme Court in Wisconsin, because that's for people that have a treatable disease, not an infirmity of aging that is not treatable, because it's gonna get worse. It's not, so there's no placement for emergency placements for people with chapter 55 Alzheimer's, and that should be made a big issue.
So Joe, are you the only one in the county that can do a chapter 51 then?
Yes and no. I mean, the chapter 51s come through here and through me or whoever represents me, my designee in my absence. But it's the police officers that put them on, in coordination with the doctors and that. But 55, it's interesting. It says if somebody suffers from dementia or an infirmity of aging, which is a progressive disease, they could be placed on a hold with the approval of the county. But they're supposed to go to a specialized nursing home, at Trumbull, and they're not supposed to be locked up with people that are, and that's what happens. And even when I called, in this case, called Winnebago, they said, yeah, it's not really safe for him to be down here, because, you're elderly, somebody push you over who's hearing voices and they're 20 years old, you break a hip, you're done for. Anyway, we could talk more about that, but that's something should happen with that.
So there is no place in Wisconsin for?
No, there's basically, all the other counties are doing, for lack of a better word, what I say always, they bastardize a 51 to take somebody that should be on a 55. And that's what these other counties are doing, and it's not right. And that's legislatively, that needs to change. And that won't change until the state develops some placements for folks like this. And the elderly people, they don't really have a lot of, they don't have anybody championing them. It's not the new group today, Everybody, yeah, anyway.
Okay.
Oh, you got a couple reports there for your review. The child placement costs, the residential care one is, the RCCs is really up there again. It's trending that way again. And then we have a CPS caseload report from Carla.
Okay.
Yeah.
Okay. Economic support.
You have a report from Shauna, and I'll just highlight, she made a note about the call center answer rate, and if you look at how they're doing, they're in the 99th percentile with responses, which I think is excellent. It can't be perfect, so calls answered, applications processed, all 99 plus. It's a credit to what the consortium's doing.
Okay. Julia?
Come up here so I'm by a speaker. Okay. Can't find my slideshow. There we go. Okay, there. Now we can see what I'm doing. Okay, COVID update. So Wisconsin has been in the yellow and continues to be in the yellow. This has been for quite a few weeks now for Wisconsin, so that's great. We are last month when I presented to the county board, we were at 8 per 100,000, and now we're down to 2.6 for the state, which is really good. And then when we move into Sawyer County, we've been hovering at the yellow, and just popped up to orange today. But last month when we were reporting out, we were in the red and we were at 34.5 cases per 100,000, and now we're at 11.2. I'm expecting us to come back down into the yellow fairly soon. One of the other things that we've been doing is really working on testing, because we're not going to be able to continue long-term to have curbside testing at the hospital. That was something that we all rallied around and put up, but it's not being used enough, and we have to use our resources responsibly. So we're working with the clinics to come forward. What does testing look like? LCO has been a great partner and continues to be. From the county, we'll most likely be doing testing in-house as well, or curbside, to make testing available. The other thing that we're looking at is there's a lot of screening that's happening for pre-surgicals, and the reason why they do this, the screening for surgeries, is because there's the possibility of being intubated, and that's why we want to know if somebody is positive or not, and if it's not an emergent situation, that we want to hold off. And then the other thing, the big thing is travel now. People want to go places, and all of the different airlines and different types of travel require different types of testing. So we're probably right now just trying to get a handle on what that looks like. And then the other testing that we're working on is the camps are opening up. So we've been working closely with them on testing strategies and working with the state, also working with the school and what that can look like as well to help keep kids in school, not sending them home when they really don't have COVID. So that's the other testing plans that we have going on. So hopefully by our July meeting, we should have that kind of hashed out. Vaccinations are, last time we were about 44%, so we're up to 46, so we're creeping up slowly. We're a little bit behind the state. The state's at 48, we're at 46, so we're not doing too shabby there. We are at 79.8% for our 65 and older being vaccinated. And every week we're seeing that 12 to 15 and the 16 to 17-year-olds rise up. So we'll continue to offer clinics. We offer clinics at least 2 days a week, going into the schools, going to winter. LCO continues to have lots of clinics and availability. They're doing LP, we're kind of really partnering. We're going to go into Arkland. We've done some work with ADRC to find some homebound. But a lot of people on that 65 and older who are homebound have been vaccinated already, which is really positive. And then the Wisconsin DHS site just got updated, so there's a lot of new information on there. The last time I reported out, CDC was just making some of those changes on now that you're fully vaccinated, these are things you can do. This is what Wisconsin DHS has put forward. So that is what some of the new sections are. The other thing that we're working on, and when I hear Lorraine talk, I always think about, where does that funding, what funding do we need to be working on, and what programs do we really need to be working together on? We have that community health assessment that is just closed up, and so we'll be working with the hospital to see what has risen to the surface there. But most likely, it's all of the things we've been discussing, mental health and addiction. So, there you are.
Question, Reed?
Julia, has your team been into the jail and vaccinated
Yes, we have.
multiple times? Or, I mean, what?
Yes, we go in, actually, whenever anybody wants to get vaccinated, so we work with Robin, the nurse, and so she's checking, inmates can email her and say, I want to get vaccinated as we go around. When we were doing the COVID testing too, everybody was hearing about and having opportunities. So we'll go in just to do one if that's all it is, because it's easy for us to jump over there.
And you do the one dose?
We have Johnson & Johnson available, but we also want to bring Pfizer in, just with some of the younger women and the risks of blood clots. Some of them are not very comfortable with the Janssen product, so we do have that Pfizer available for them as well. So,
Yeah, because we were worried about the jail.
Yep.
We were getting reports from some of the inmates and that outbreak that happened. And we were hoping that we could get them vaccinated, but that didn't happen quick enough, I don't think. But then things were taking place, so I know that you guys are getting in there.
yeah, we had actually done a series. We had gotten in there a good month before this had happened with the infections. So we had a number of people that were fully vaccinated, so that was good. But
Okay, Mr. Olson?
Oops, sorry.
No, no,
Thank you, Julia. Great job as usual. Just wondering, I don't know if you caught the news this morning. They talked about California had changed their protocols for what they were considering a COVID death, and it reduced their COVID deaths by 25%. If you didn't catch the news, I guess this point is moot. But I don't know if you could speak on it.
Well, what I can tell you is that Wisconsin, what they look at is what is on the death certificate. And they actually go in and they do a review of the health records to determine if there was any COVID related with that. And that's really how influenza and pneumonia and other things are coded out as well. Our county works really hard at not putting anything forward until we know we have it affirmed there. So I feel really confident about the work that the team is doing as far as looking at all of those cases. There are a couple things I can just kind of speak to when it comes to COVID-related deaths. Some providers do not want to put COVID-related death on at all. They want to just keep completely away from that, and they won't add it. And other providers will add it maybe when we kind of see, this, they were in for something else, but they happen to be positive for COVID. We'll go back and talk to the providers on those cases, and because those we don't want to report out when they truly are not a COVID case. So if they were not being treated for COVID, just happen to be positive, it should not be a COVID death.
Are you seeing, what kind of results are you seeing are those who are positive after being vaccinated? Is it low?
It's pretty low, very low.
Because there are some who have been.
There are some, yep, and we know that. We know vaccines are not 100%. I mean, our vaccines for COVID are actually a much higher effective rate than other vaccines are that we usually get. So we're really lucky that they are so effective, but we do know that different people have different antibodies to build up that immunity. And others, you're just going to get that breakthrough. The important thing that we want to watch for, though, is to see if there are any variant strains that keep breaking through. And if they keep breaking through, then that's when that booster will be coming out.
So are you still seeing a lot of people who fear getting the vaccination because of the side effects, or?
It's not really like the true, like, oh, I don't want to feel sick side effects. Those don't seem to be the ones that people don't want to get for. It's, kind of misinformation
Yeah,
of what can happen. Yeah.
This is what I hear.
It's not, oh, I don't want to have a sore arm and I don't want to get sick. It's all the other misinformation. So.
Tweed, you got a question?
Yep. Julia, did you get extra money? Because at our Indian Health Service facility, we got separate money for COVID vaccine related activities and COVID testing related activities.
Ours is in one pot.
With the county's 3
Ours came in for the county. And our testing, and so last year it was separate.
Right.
It's all kind of different. The pots of money come out differently. Now they've lumped some of the testing and the vaccine, anything to do with COVID related, even recovery types of things that we need to be working on is lump sum into that. So, yeah, that's the only way we would have been able to do all the contact tracing and the vaccinations that we've done.
But that's separate from the 3.2.
It's not, yeah, it's not, but it was never budgeted for. It just came in.
Oh, right, that was my question.
Oh,
County got
sorry.
3.2, Health and Human Services got another
Oh,
pot.
and I got, yes, I have another pot of money. Yeah.
Good.
Julia, you said twice a week you try?
Yep.
The
For the
vaccination?
vaccines, yep, Tuesdays and Fridays are our typical days.
How many people are showing up for the?
We are seeing probably about 20 to 30, and that's between first and second doses. Now, next week looks a little quiet, but this week was really busy, so
There seem to be a lot of younger people there.
a lot of younger people coming in, yep.
Is there, are there a lot of people who say, I'm just anti-vaccine and won't go?
And I know they're out there, but we're not seeing that as much right now. It's just that pull in to be able to, they're calling us and wanting to get in and get vaccinated. And then we're telling people go and tell your friends, you know, and it's kind of, it needs to happen at that peer group. What we are doing is working as a state, and actually I was on a call with the CDC on rural health and talking about, they wanted to ask us questions on, it was kind of a few of us representing rural health and asking us questions on what we're seeing and what we think needs to happen. And really it needs to happen at that peer level and community level of friends and neighbors talking to one another, not the government saying, get vaccinated.
And I mean this facetiously, but spread the rumor that there's a shortage of vaccines and be prepared for 200 people to show up.
Well, I think that one of the things that
First
one of the
psychology.
plants said if they were vaccinated, you don't have to wear your mask more.
That
That motivates
actually
people too.
is happening in a few different plants. They
Yeah.
are moving to if you can come in and show us that you're fully vaccinated, you don't have to wear a mask at work. We didn't go down that route, but some of the plants are working in much
Yeah.
tighter situations
they
that you kind of need to have that. So yep, so different places are doing different things.
Yeah, whatever you do.
Okay,
Thank
thank
you.
you very much.
Thanks, Julie.
And part A of that was unsafe living conditions ordinance. That was pretty much an FYI to let people know that Sawyer County does have ordinance against unsafe living conditions, but it was brought to public safety by ambulance that first responders were having trouble getting into some houses just because of the hoarding and so forth. But that's not an issue we need to deal with. It's more like an FYI. So we'll move on from there. Fleet of county cars.
I don't know who put this
Not
on.
Paul, Tom. Oh, Paul.
Patty?
No, I don't know who put this on here. I didn't.
They always put it on there. After
Why
the senior
not?
resource meeting.
After that, yeah. I talked to you, didn't I, Tom?
Yeah, normally I think there's a quarterly update on the fleet, but I don't know if this is, if we don't have one, we'll do it when the quarter ends, I guess. Unless Patty's on the line that has more answers.
She is on.
Maybe I misunderstood. Patty, did you prepare a report on this or not know anything about it?
I don't know anything about it. We would have one in July through June, but I don't have anything in June.
Okay, that's my bad. I apologize.
So just leave it on for July.
Please. Budget performance reports. I'm missing something. Where's the rest of our agenda?
There's the third page.
Yeah,
Turn that one over. No one in your hand. Go in your hand. There you go. I think that's the one.
yeah, there it is. Thank you. Sorry about that. Youth justice.
An A, Youth Justice Report. Brittany.
I'm sorry, Mr. Chairman, I had a question on the budget performance report.
Sorry.
I was just waiting for you, okay. Maybe Patty could answer this. Patty, what is gonna be the budget impact of these diversions that behavioral health has put in place now, moving people out of Winnebago and into these other lesser cost facilities? Have you started to realize that yet? And are we gonna come in within our budgeted number, or are we still concerned?
I have no idea.
To answer your question, we haven't seen anything yet because the bills are probably still coming to impact that. So we'd still be trending higher, but you still have one person in in residence at Winnebago, and we budget $600,000 a year for Winnebago, and that's about what that one person costs. So maybe we'll be just a little over as opposed to, oh my gosh, over. But at this point in time, we aren't seeing those, we aren't seeing it yet because the bills are still coming for their moving out of Winnebago.
Okay. Any other questions on the budget? Now youth justice.
Brittany Haig was here, submitted her youth justice report for your review.
Any questions, comments, discussion?
I gotta get to it here. So I'm just trying to pull it up again and dump that. What is our capacity now, or where are we at in Oasis now?
At Oasis, there's currently 4 residents there, 1 in county, 3 out of county. But one of those residents is absconded and has been gone for approximately 7 days. So they would close that placement after a period of time if he doesn't return. And that's an out of county resident. That's on the run in our community.
Does anybody have anything to add on this?
Not at this time. We do have the option of going into closed session to discuss negotiations with them.
Okay.
Where are we at with negotiations? Didn't we leave our last meeting that we were gonna have you folks talk to them and come back with a report, or do we have to do that in closed session?
Yeah,
Yes.
so, Dale,
Don't you have to say we're going into closed session?
I was gonna wait and see if there was any open discussion first, but yeah, we can move into closed session now. I'll need a motion and motion.
I'll make that motion to go into closed session pursuant to Wisconsin statute S 19.851E for the purpose of deliberating or negotiating the purchasing of public properties, the investing of public funds, or conducting other specified public business.
Motion by Tweed, second by Carol.
Yeah. I was just gonna get up and shut the door was on.
I see that.
Oh, thank you, brother.
Everybody in favor, say aye.
Aye.
Motion passed. Back to open session. That takes care of our agenda. Meeting adjourned.